Kailey is a third-year Bachelor of Science Kinesiology student here at Laurentian University. She was awarded an NSERC Undergraduate Research Assistantship in the summer of 2024, where she worked on various projects with CROSH. And I think she's talking about one of those today. And so far, her work with CROSH has primarily focused on air quality awareness. So welcome, Kailey, and I'll let you take it away.
Thank you everyone for coming and joining me today. And thank you, Dr. Dorman, for the introduction. So like I said, I am going to start off with that quick poll. And the poll is asking you what you would do if you noticed high carbon dioxide levels in a room. I just wanted to make a note that carbon dioxide is not carbon monoxide. Carbon dioxide is a gas exhaled by humans and a byproduct of many other things. So while you go ahead and complete the poll, which it looks like everyone did, I am going to give you an overview of what I will be presenting today. So I'll be sharing my research on indoor air quality, carbon dioxide monitoring, and citizen science. I worked on this project with Dr. Goggins, Alexander Bertram, Taryn Thompson, Courtney Lessel, and Dr. Godwin. And I'm going to be talking about the research background, the purpose of the study, how we did it, our findings, and the main takeaways for you today. So based on the poll results, it looks like I saw that most people had selected open a window or a door to improve the ventilation. So why is indoor air quality important? Well, since we spend 90% of our time indoors, and this has only increased since the pandemic, access to good indoor air quality is more important than ever. So when indoor spaces often have higher concentrations of pollutants, with indoor air being 2 to 5 times more polluted and 100 times more concentrated than outdoor air. Pollutants like carbon dioxide, so CO2, carbon monoxide, particulate matter, and particles from everyday activities like cooking, cleaning, and even just breathing can affect air quality. So poor indoor air quality isn't just inconvenient, it does directly impact health by contributing to cardiovascular health, respiratory health, hypersensitivity, headaches, inflammation, fatigue, decreased cognitive functioning, and cancer. So the problem is that many people are unaware of indoor air quality and its impacts. As a result, most people do not actively work to improve the indoor air quality of their household or understand their workplace exposures. Interestingly, while people do believe their air quality is good, this perception often doesn't actually align with the exposure levels. So this relates to the value action gap phenomenon that describes that even when people do know that their air quality is bad, they often don't do anything about it. So CO2 can be used as an indicator of indoor air quality. So one, CO2 is an easy way to measure indoor air quality and how well a space is ventilated. Since human respiration is the primary source of indoor CO2, its levels are largely influenced by occupant density and ventilation rates. Beyond its role in ventilation assessment, CO2 has gained attention for a way to assess the risk of airborne disease transmission. So high CO2 levels suggest poor airflow, which can increase the chance of viruses like COVID-19, measles, and the flu spreading. This is also tied to the concept of free breathe air, when exhaled air containing CO2 and possibly harmful particles is breathed in by others in the same space. New research does show that high CO2 can also help viruses stay alive longer in the air, making transmission a lot more likely. This does highlight why it is crucial to monitor CO2 levels to protect both air quality and public health. And finally, Canada's guidelines set a recommended exposure limit of 1,000 ppm, so parts per million, to minimize health risks. Achieving this can be as simple as opening a window to increase natural ventilation. Although CO2 is a practical indicator for ventilation, it should not solely be relied on as a measure to assess indoor air quality completely. So why did we choose to pair up with citizen science and public libraries? Well, citizen science is when the public works with researchers mainly to collect data, and it's become more popular thanks to technology like these portable and low-cost tools. With real-time data, participants can directly relate it to their lives, empowering them to be part of the science process and even influencing policymakers' decisions. We chose libraries because libraries are great for these types of projects. They are a trusted source of information. They do cover a wide area. They're pretty much accessible to everyone and can help reach diverse populations, promoting health equity. So CAVI, which is the Community Access to Ventilation Information, is one of the groups that has been supporting the public library CO2 monitor lending program by essentially providing information to libraries as well as communities. They've created this interactive map, which I have here, that shows where all the active libraries participating in the program are located. And the purpose of this map allows individuals to easily locate nearby libraries where you can borrow these CO2 monitors. And then here I have a more zoomed in version of the map that shows you some locations in Ontario. So the AirNet 4 is a low-cost CO2 monitor, and we chose this monitor to essentially because it's very accessible to anyone. There's essentially nothing you have to do. You can just sit it in a space and it is constantly going to be monitoring the CO2 levels. It's also low cost compared to other items priced at around $200. And then as you can see, there are some other features like we have temperature, humidity, and a few others. While it may not be as precise as some higher end models, it does still provide us with reliable CO2 measurements and uses a very straightforward color-coded system to help users assess air quality quickly. So we have the green, which indicates low risk with CO2 levels below 1000 ppm. We have yellow, which signals a moderate risk with CO2 levels in the range of 1000 to 1400 ppm. And then we have the red, which represents high risk with CO2 levels exceeding 1400 ppm. So why does this matter? Why is it important for you? Well, it is simple. People are spending more time indoors, and since the pandemic, more people are interested in measuring air quality. And with the concerns about airborne disease spread, measuring CO2 is a simple, affordable way to check air quality and ventilation. In this study, we aim to evaluate the use of a low-cost monitor and a brief online learning experiment to improve individuals' awareness, understanding, and management of CO2 levels in their households. Now, I'll give you a brief overview of how we actually did this project. So we used a community-based intervention approach to educate the public about indoor CO2 concentrations, residential indoor air quality, and possible health implications during the airborne COVID-19 pandemic. We partnered with 13 libraries in Greater Sudbury, Ontario to create a free program where community members could borrow CO2 monitoring kits. And these kits were equipped with an AirNet 4 monitor, educational materials, and participants were able to voluntarily borrow CO2 kits from their local library between August 2022 and June 2024. So the educational pamphlet included in the CO2 monitoring kits provided information on how CO2 levels can influence indoor air quality and how it can be used as an indicator of infection risk. It also provided information on the AirNet 4 monitor and how to interpret the CO2 readings. In the pamphlet, there was also a QR code that participants could scan, and if they scanned this QR code, it brought them to a Google form that guided participants to do the experiment, showing them how to measure CO2 levels in their space and what can impact these CO2 levels. And then finally, there was another QR code that linked to the Raven Clean Air site that allows participants to update and check CO2 levels in local places shared by others. So once participants scanned that first QR code on that third page, they were directed to a Google form with 6 short experiments. These experiments measured the CO2 concentrations after a 2-minute interval in their home. And in the first experiment called Measure the Air, participants learned how to use the AirNet 4 monitor by measuring CO2 levels in a small room. And this also served as the baseline. The second experiment, Change the Air, showed how adding more people to the room increases CO2 levels over time. The third experiment, Exchange the Air, instructed the participants to open a door or a window in the room to inform participants how the use of ventilation techniques can reduce CO2 levels. In the fourth experiment, More Space, participants were asked to move into a larger area with fewer people to demonstrate how the size of the room impacts CO2 levels. And in the fifth experiment, Breathe More, it instructed participants to engage in 1 minute of physical activity and observe how activity levels affect the level of CO2 within a room. So for instance, an individual who is exercising will exhale more CO2 than a sedentary person. And then following the fifth experiment, participants were asked if there was a window in the room where they exercised and were directed to open the windows and complete a short reflection on the experiment. So the post-experiment questionnaire asked participants to reflect using a Likert questionnaire, and the questions assessed their perception and learning of indoor air quality strategies to mitigate COVID-19 infection. It also assessed the usefulness of the experiment and the price range they would spend on a CO2 monitor. So what did we find from all of this? Well, one of the key areas we looked at was the monitor checkouts at the libraries over time. So between August 2022 and June 2024, there were a total of 114 checkouts. And the table pictured here details the number of checkouts per library in Greater Sudbury. We had the main library and the South End Library recorded the highest usage with 21 checkouts each. On the other hand, the Coniston Library had no recorded checkouts during this period. Out of the 114 participants who did borrow monitors, only 18 participated in the online experiment and submitted their results, giving us a response rate of 15.8%. We also looked at the timing and frequency of the checkouts. So we observed that January 2023 had the highest number of checkouts with 15, and that the number of checkouts generally declined after that. Additionally, we looked at whether there was a correlation between COVID-19 outbreaks in Sudbury and the checkout rates. However, there was no statistically significant correlation between checkouts and outbreaks. I do have a graph here for the Sudbury region. And essentially, we have right here on the horizontal axis the dates in the month. And then we have the number of checkouts and the number of outbreaks. So the number of checkouts are represented by this black line. And then the number of outbreaks in Sudbury are represented by this gray bar right here. And then we have a black bar for May 2023, and this represents the month where the World Health Organization revoked the classification of COVID-19 as a public health emergency of international concern. In terms of the CO2 concentrations measured at baseline, the average CO2 concentration of all participants was 944 ppm, with only one person reporting a CO2 concentration greater than 1,400 ppm. When compared to the baseline, experiment 1 measured the air. The Exchange the Air, More Space, and Open the Window Longer all improved air quality. However, Exchange the Air and Open Window Longer resulted in statistically significant reductions in CO2 levels from baseline. And this highlights the effectiveness of natural ventilation strategies like opening the doors and the windows. The reflection questions after the experiment gave useful insights into how participants think and act about indoor air quality. So we found that half of the participants were surprised by their CO2 levels, which can indicate that they did not know much about their home's air quality before. 94% said that they learned something about CO2 levels and air movement in their home. 77% found that the experiment was useful in understanding CO2 and airflow in their home. And when asked what to do to reduce the risk of spreading the disease to other household members, if there was a known case of COVID-19 in their house, participants said they would wear a mask, use isolation measures, open the windows or doors to increase ventilation, or a combination of these. So surprise, learning, usefulness, and participants being able to make the connection between actions in their home and the impact of their indoor air quality levels equips them to manage indoor air quality and shows the increase in awareness and knowledge. So while participants did gain knowledge, only a moderate amount, so 44%, said they would be likely to adjust their decisions on restaurant selection based on having access to the CO2 results during another wave of the COVID-19 pandemic. Cost was also a barrier. Most participants were unwilling to spend more than $50 on a CO2 monitor, and no one would spend more than $200 or more, even though the AirNet 4 is currently priced at around $200. So this indicates that awareness doesn't always translate into behavior change. And affordability does play a big role in whether people can implement the use of a CO2 monitor in their everyday lives. So before we wrap up, if you were to leave this talk today with any information, this is the information that is crucial for you to know. First, poor indoor air quality poses serious health risks. But the good news is we can make it better through simple ventilation strategies like opening windows or door, reducing the number of people in the room, using a larger room, and other techniques. Clean air should be a priority, not just for us, but for our families, friends, coworkers, and community. Reducing CO2 levels doesn't just make the air fresher. It can lower the risk of airborne diseases spreading. Think about how much that can mean during cold or flu season, or even when we're trying to prevent something from spreading that is more serious. These devices can help you understand your own indoor air quality in your home or workplace. So don't forget the basics of ventilation. Open a window, prop open a door, let the fresh air in to keep your spaces healthier. So I urge you to spread the word about the importance of clean air and CO2 monitoring. Talk to your coworkers, your neighbors, your loved ones. If each of us takes small steps, we can make big changes protecting ourselves and those around us through very simple ventilation strategies to improve indoor air quality. So to close this session, we are going to revisit with the same question that we started with. So I'll give you a little bit of time to fill out the poll. Great. So now for those that you are curious, out of all the options, opening a window or door is the most effective way to reduce CO2 concentrations because it is the easiest and is the most reliable way to improve air circulation. While other tools like air purifiers and masking do have their place and are useful, they don't directly reduce the CO2 concentrations in a room. So thank you for attending and for listening in, and I'll take any questions if there are any.
Wonderful job, Kailey. That was really interesting. I've got to say, I have one of the monitors in my living room. I've had it there for, I want to say about 3 months now, and it really does impact me opening the windows and everything that like, what a difference as soon as you have like the whole family in the living room, the carbon monoxide levels really do go up. And
Yeah.
it probably takes like, I don't know, like half an hour with the window open to move the air through. So it certainly raised my awareness.
Awesome.
My question, sorry, after all the rambling there, is like I can sort of see how maybe I wouldn't change my decision about going to a restaurant based on their carbon dioxide levels, but I might feel differently about if it was my workplace. Do you have any thoughts about like workplace monitoring? Whether like are there places that maybe should be monitoring, or do you think that workers would be interested in seeing their workplace carbon dioxide levels? Or
Yeah, I think that there definitely would be an interest in seeing the workplace CO2 levels in the actual workplace. I do think that this would be really important for small businesses just because they might not have like a health and safety committee or maybe not a well-established one. So it'd be really helpful to have one of these monitors in the small businesses to see like, can we open our doors or our windows? And I think even just like in general, when you have a lot of people in large meeting rooms, like keeping that door open instead of having that door closed. So then there's not, we have a whole bunch of people in a room and then all the doors are closed or the windows are closed. And that can also really increase the CO2 levels.
So can you do anything for like a space where there is no windows?
Yeah, so I think that in those situations, air purifiers still can be helpful. Like I said, they don't directly reduce the CO2 concentrations, but when we're talking about preventing the spread of a illness, they can remove some of those and like filter out some of those virus particles. So
Right.
that can be helpful. But if there is no window, if you do have like a larger space that you can move to, if you have a lot of people, or if there is a door that can be open just to increase like that ventilation, those can all be very helpful. Wearing a mask can help as well, just because then we have less CO2 being exhaled by the people in the room because we are wearing a mask. So there are places for all of these different strategies.
Okay. Okay. Yeah, because I mean it's winter time and it's not always
Yeah, I know.
possible.
Yeah, it definitely gets
But
a little cold when you open a window at this time.
well, I'm sorry. And there's a couple of questions that have popped up as I'm rambling with you. Um, Tradition says, great presentations. It's interesting. I was wondering if the quality of the air in general, as in where you are living, for example, as in where you're living. For example, parts of the GTA is moderate levels. So if you live in those areas, would that make it worse indoors than like, yeah, a more rural community?
To be honest, I wouldn't be able to 100% answer that right now. Maybe if Dr. Goggins or Dr. Godwin is on the call, I know they have a little bit more experience with that. They might be able to help with that one.
Yeah, for sure. So thanks, Kaylee. So it's Katie here. And so yeah, so with different pollution levels, it'll just depend, but it depends on what's in the air. So the air quality is different depending on the area. And if you're just looking at your apps or things where it's giving the air quality, that's not necessarily a correlation back to CO2. So just keep in mind this monitor is really specific to just CO2, not other pollutants that are in the air. So it'll just really depend on if you're near anything with like a lot of exhaust. So anytime you're closer to roads, you're living in apartments closer to roads, if they're not getting enough air exchanges and that kind of thing. So you might see a difference, but keeping in mind this one is for CO2. Thanks, Kaylee. Great presentation.
Okay, I apologize. We have to move on to the next speaker, but Marcia, just to let you know, the AirNet monitors are still available at the libraries in Sudbury. I think there's still 7 of them, so you can just go in and put them on hold and pick them up at the library of your choice.